Hey, how are you? Okay. Well, I saw that we have you here today for a routine ear cleaning. And before we get started, I just have a couple of questions. First being, are you having any pain or pressure in your ears? How about any dizziness? Okay. Are you feeling or hearing any kind of crackling when you swallow? Any diminished hearing? Okay. And any recent colds or congestion? Okay. And your medication list, is it up to date? Have you added anything or stopped using anything? Okay, good. Then we can move on. And before we start looking at your ears, I actually want to palpate your sinuses and also check for any lymph nodes or inflammation along those lines. Just because it is allergy season, and sometimes also people can mistake allergy symptoms for a cold or vice versa. So before we do anything with your ears, I just want to make sure that there's nothing that might contraindicate the procedure or that might require us to do this in a different way. Okay? Okay. So I'm going to be palpating around your face. I want you to tell me if anywhere feels particularly tender or sore. How about these areas here? Okay. I'm not feeling any evidence of any kind of sinus inflammation. Actually, I'm going to palpate your eustachian tubes. Can I have you swallow? Okay. One more time. Not feeling anything concerning there. Alright, so now I'm going to take a look inside of your ears and see what's going on. Yeah, okay. There is actually quite a good amount of serum in here. Not seeing any redness though. But there is enough wax that unfortunately I'm not able to visualize your eardrum. So, okay, let's check the other side. Oops. Okay. Yep, this side is pretty full as well. Same story here. There's a bit too much wax for me to be able to see your tympanic membrane or your eardrum. But the good news is that I don't see any redness. So, okay. Let's take a peek inside of your nostrils. Okay. Alright. Well, nostrils look clear. And can I have you open your mouth for me? Great. This is just going to press down lightly on your tongue so I can get a clear view of your throat. And I don't see any redness or anything indicative of any kind of postnasal drip or drainage, so okay. Move that. So from what I can tell, there aren't any kind of signs pointing to a possible ear infection. But because I'm not able to visualize deeper inside of the ear, I can't completely rule out the presence of fluid. So we're going to stay away from any kind of irrigation or drops today. We'll use some air and some instruments just because if in fact behind that cerumen that's blocking my view of your eardrum, there is some fluid present, I don't want to exacerbate the situation and cause you any kind of pain, okay? Okay, this one little renegade hair here wants to curl up around my eye. So So then really quickly, I'm just going to examine your external ears, okay? So, again, let me know if anywhere is tender. To rule out any kind of skin infection or anything, just so we can avoid the spread of bacteria. Because our ears have these little nooks and folds. Bacteria and even fungal processes can get trapped and grow. But externally, your ears look good. I don't see anything that could possibly be problematic, so excuse me. Speaking of allergies, they're also affecting me. But anyway, we can go ahead and proceed, okay? Okay. So I'm going to start just by grabbing one of these drapes. We're not using any liquids today, but just in case anything were to fall, that way it will protect your clothing. I'm just going to tuck this into your collar, okay? I wanted to sneak out. So I'm going to start with this. You might be familiar if you have little ones. In our case, we're going to be using it just to kind of blow away any of the looser bits, okay? And then I'll go in with some different instruments, which we'll talk about as we go. Okay. Alright. Grab another one of these. So now I have these tweezers, okay? And they have a very blunt tip, so even if you get jabbed a little bit, it doesn't hurt. I'm just going to try and pull out any kind of bigger bits, okay? So now we get there. Okay. I think we can go in next with the pick. So this is like a pick or a carrot, okay? And it has this little scoop that kind of lets me go in and drag away anything that might be kind of stuck to the sides of the ear canal. I do want to be clear that I don't recommend using this on yourself. I know they sell these ear cleaning kits on like Amazon, but the problem is that you can't see inside of your ear to see where you're going. And I know that some of these come with like a little camera, but again, you're watching through a camera, which can sometimes have a little bit of like a disconnect, I guess, with coordination. I always emphasize to let me or another professional do it, just to avoid any kind of accidental like puncture of the eardrum. It's very painful and definitely don't recommend it. If you ever do need to try and clean your ears at home, I usually recommend patients use water, like either kind of tilting your head in the shower to let water in there, or putting your head under the water in a bath and letting the water kind of rinse what it can out. But anything else that's not willing to come out with water, come on in and let's have us take care of it, okay? Okay. So I'm gonna go in now. All right. Okay. Keep that there for a moment. Now I have this little silicone brush. It's very gentle. And it's just going to kind of help and collect any of the little bits that might still be stuck in there, and like the little hairs. That way it kind of helps remove anything that might start to reaccumulate. So this part might be a little ticklish, I'm sorry. Alright, so now I'm going to look inside your ear again, and this time I'm going to be using something called an insufflator bulb. What that's going to do is allow me to blow little puffs of air inside of your ear, and I can see whether or not your eardrum vibrates and moves appropriately. If it does not, that can indicate there being some fluid trapped. So, I'm going to pull your ear back here so I can get the right position. Okay. Oh yeah, we're nice and clean in here. That's good. So here comes those puffs. pull in your ear back here. Adjusting my angle. Okay. All right. So your eardrums were vibrating as they should, so that's good. I'm just gonna make sure 100% by just looking in your throat again to see if there's any kind of drainage. So if I can have you open. Great, thank you. All right. Take that back. Throat looks good. And I'm going to repalpate the parotid lymph node area and some of your sinuses. Can you swallow for me? Good, okay. Alright, not feeling anything concerning, so that's good. I just like to completely rule out any kind of signs of any sort of otitis media or ear infection because those can be very disruptive to life and very uncomfortable. I'm going to take off your drape now, okay? So. All right. So how are you doing on your prescriptions? Do you still have any ear drops left? Okay. Have you been using them? Okay. That's fine. No judgment. I would encourage you, after having your ears freshly cleaned though, to go back to using them again, so that way we can help and stretch out the time between cleanings to be a little bit longer. But that being said, if you need to have your ears cleaned, please don't feel like you can't come in. Don't judge anybody. I just want you to be comfortable, okay? Okay, just a second. I'm just gonna write a quick note. Okay. So, if you do run out of eardrops, give me a call and let me know, and I can send in another prescription for you, okay? Okay. I would like you to return to clinic in 6 months, or sooner if you need a repeat cleaning before that, okay? Okay. Don't let it wait if it starts getting bad. All right. It was really nice to see you. I hope you have a good weekend.